My name is Nicole, and I'm an oncology PA and dietitian and functional oncology coach. And I got into functional oncology to help fill the gaps that women with breast cancer were experiencing in conventional medicine. So now I'm helping them tolerate their treatment better and reduce their recurrence risk as well.
Yeah. And my name is Devin Owens Toller. I am a breast cancer survivor and patient advocate, working with and partnering with Dr. Nicole for my own health and own functional oncology journey. But we also wanted to just share some more information about how functional oncology can help breast cancer patients and survivors as they navigate treatment and then survivorship as well. So I'm excited for this conversation. Let's jump into it. Are you ready?
Ready?
All right. So, firstly, what is functional oncology and how is it different from conventional oncology?
Yeah, so when we look at conventional oncology, it really focuses on the tumor and using things like chemotherapy, surgery, radiation, or like hormone therapy. And they're life-saving and absolutely needed to help shrink the tumor, get rid of the tumor, and keep it from coming back. But functional oncology is more of like a personalized root cause approach that works alongside conventional oncology. So this really focuses on kind of like the whole terrain of the body and influences how someone tolerates their treatments and even how well their body can heal afterwards. So things that we work on and really look at are like nutrition and metabolism, inflammation, gut health, detox pathways, and just nervous system regulation. So we look at the whole body and how that is going to impact along with your conventional oncology.
Okay. So, for me, I discovered you by happenstance, scrolling through TikTok.
Yeah.
I didn't hear about functional oncology as I was starting out in my process. So, why do you think functional oncology isn't kind of introduced to us when we're at the beginning stages of our diagnosis?
Well, I think it's not quite the mainstay of what medicine is. Medicine, we are trained to really identify disease and treat that disease from coming up with a diagnosis and like what medications that we should do. And functional oncology is looking at more like root cause. So not just like you have this disease, you have breast cancer, but looking at different reasons of why you developed this disease, these symptoms, and then how we could fix those things.
Okay. Great. So, to that point, since we don't hear a lot about it, we can kind of have some misconceptions or kind of question marks around what it is, if it's effective. So, can you talk us through kind of what those misconceptions are that patients typically have?
Yeah, so one common misconception that I see that is if people choose to do functional oncology, that means that they're rejecting everything conventional. And that's just not what I believe. I believe that like you do need the conventional oncology to actually treat the cancer, treat the tumor, prevent it from spreading or from coming back. But functional oncology is just on top of that. I know with like a lot of chemotherapy, hormone therapy, your body goes through a lot of stress. And so using functional oncology with that just is going to help people tolerate the treatment better. So looking at a lot of like imbalances, nutrition, just like how we can improve metabolism, sleep, reduce the inflammation, so it works right alongside with the conventional treatments.
Okay. So for me, in terms of our partnership together and kind of why I reached out, to your point about having kind of both sides of the coin, I wanted to really understand, potentially, I guess, maybe why I had breast cancer, but what else was going on in my body and how I could really use this phase of my life and phase of survivorship as a starting point, to really get even more healthy. I thought I was doing the things, but there's always levels to it. So I really wanted to work with a functional oncologist to understand what was truly going on inside my body, and how I could support it, how I could, change into what I was eating, the supplements I was taking, habits, and things like that. So I really wanted to make sure that I was taking that holistic approach when it comes to my care.
Yeah. Yeah, I mean, I hear from women all the time that are like, oh my gosh, I exercise all the time. I eat so healthy. I do
Mhm.
X, Y, and Z, take all the supplements. And like, I still got cancer. So, like, why? Right.
Mhm.
Unfortunately, there's not a tool that we can just like pinpoint like one little cause of the cancer. It's really just looking at like toxin load over time,
Mhm.
um, from a lot of the things that we put in our body, on our body, just like the environments that we're in general, and then from various different causes from how you were birthed, being bottle fed, puts our body at different immune risks. And so looking at that and really looking at and developing a plan to help kind
Yeah.
of fix those things and modify those risk factors.
Yeah, for sure. Well, thank you so much. This is a great kind of basic conversation and introduction to functional oncology, and I hope y'all learned something new.